go to a healthcare place, they lack Spanish-speaking healthcare workers. So a lot of the times it's hard to communicate with them. Even if there's translators, sometimes they're limited. And so there's a big gap with that. And I know that sometimes you see information out there that's wrong, and they are fact-checking organizations there. But the thing is, they fact-check those English sites and information, but then they miss a step of, if that information potentially was translated, they forget to go and fact check that information that is in Spanish. And again, it's going to that access of lack of medical care and all of these resources, and they receive lower quality of care than whites. And a lot of the times they relied on information when it comes to friends and family. This is something that I was reading when I did a presentation on misinformation and how people rely on family and information, or whatever they see, they believe. This person is said, basically, for example, her parents suggested that she wouldn't have to quarantine if she drank a homemade tea of lemon, honey, and ginger. And the daughter had to tell them, no, that's not true. In order to stop spreading it, you have to stay at home. So again, those are the information that people might be spreading without knowing that that's incorrect. Or the other thing too is, especially when it comes to the information out there, a lot of the Latinos in the US, they don't trust government. And so therefore they say, if I'm hearing something from the government, from people who that are related to the government, I just don't trust what they say. And so I'm not going to do anything because I don't trust what they're saying. So that's a little bit of the background when it comes to the information, that where they get it for, and how health information definitely impacts people's lives. And so one of the things that we wanted to do was we wanted to see, okay, how can we get to the Latino population in a different way to provide them with information that they need and incredible, and be able to reach out to them. So we did, and we did some research and realized that Latinos use the smartphones and the internet heavily. As you can see, 92% of Latinos 18 years older own a smartphone. They 84% carry their phones everywhere. And a main driver to connect with the community tends to be more to be in connection with family and friends. And according to the Pew Research Center, 73% of Latino adult smartphone users and owners use their phone to seek health information. So I think about that. It's 73% of people that speak Spanish use their smartphones to look for health information. So knowing this, I, being the librarian at the Dykes Library at the University of Kansas Medical Center, and having a relationship with Mariana at Juntos, I wanted to see what can we do. They're doing a great job. They basically, their role in Juntos is to seek and generate, disseminate knowledge to eliminate health disparities in underserved Latino communities in Kansas. They want to educate them. They want them to be able to participate more in clinical trials, in research that the university is doing. So there's a lot of great things that they're already doing, but they feel like they reach out, they have partners with the community, but they wanted to do more. And like I mentioned earlier, I had worked and had collaborations and partnerships in my previous jobs, and I had actually applied for grants to do outreach at the National Library of Medicine to promote health literacy and consumer health resources. And I told them, let's see if there's any money available that the National Library of Medicine has, that they would love to fund you a project if you have an idea of something that you can do to reach out to this community and incorporate health literacy, credible information resources into the project, and see what we can do together. And so we were brainstorming ideas. How can we get health information that is credible to them? And they had an idea of saying, well, you know, they're using the internet, they're using their smartphones. Maybe we can do something that we can record and they can listen to when they have their phones accessible. And so by doing that, we looked at the network of the National Library of Medicine, and I definitely feature this here because I recommend you, depending on the library that you work at. I know a lot of public libraries tend to get a lot of health questions. I really recommend you checking it out and see if there's any idea you want to do to promote health literacy, healthy eating, or any project to do outreach. they would definitely would like to fund that project. So the network of the National Library of Medicine has different networks around the country. Ours, we're in number 4 right there. And they, if you go to it, there's a lot of funding opportunities, and you can see on my last section here, there's resources for funding, and they fund different projects. When I was in Miami, they funded a project for us to work with public librarians at health fairs, and that the medical students were doing. And when they had a specific question about a health topic, as a medical librarian, I would tell them some of the consumer health resources such as Medline Plus. And if they said that they didn't have any internet or access at home, we had the public librarians, and they would show them what was the closest public library to their home, and they can go and say, hey, you can go to your public library, use their resources, and we can also help you with some of those questions. And so they funded that project, and that's how we also were able to get funding for this project that I'm going to talk to you about. So I definitely recommend you checking them out if you have any idea or project, or reaching out to me if you have any questions of that. So as we were doing the research and trying to find a project, we said, well, it looks like there's evidence out there that the Spanish-speaking Latinos go through podcasts and social media when they're using their smartphones. Well, we got the funding, we got the idea, and we said, why don't we create a podcast of recordings that could reach out the community in Spanish, but also having the health literacy aspect of it. Let's have also credible health information resources as part of that, of those topics that we're going to be covering, and be able to say, if we're talking about diabetes, if we're talking about Alzheimer's, let's have a conversation in a casual way about the topic, have it in Spanish, and then have Spanish-speaking healthcare providers doing those presentations so that they're credible, they're part of the community, and they have those conversations, they give them information, they cover myths and facts, and then add to that, supplementing with good, credible information on the topic. And that was my role as the librarian. They would do the recordings, get people with specialties that spoke Spanish, and then reach out to me, and I would seek out, supplement credible resources to add for the topics. So again, we looked, when we knew that we wanted to reach out the community this way, we looked at the literature and did a literature review and looked at what would be the best platform to use. So as we did that, we noticed that they use their smartphones, they use Facebook, they use YouTube as the most useful apps, but we thought, you know what, we can also incorporate podcast into that mix to see how we can reach more to them. And so as you can see, they're definitely out there. They listen to information videos in social media. So we wanted to reach out to them in that way. As you can see, audio streaming services, it was 45%, social Facebook 66%, YouTube videos 58%. And also they use Latinos spend considerably time every week on a smartphone, including an average of 16 hours in apps or webs, and 4 hours in social networking, and about half an hour listening to streaming audio. So now that we knew that we had the evidence that they spent time in those platforms, we got together and said, okay, so what can we do now then? So we got that idea. We know we wanted to do the recordings. We picked out the platform. We knew that because being at KU Med, we have access to a lot of the healthcare providers, and we were fortunate to have different ones that spoke Spanish. And so we submitted the proposal, and we were very fortunate that it was approved and got funding for it. So the idea was having a Spanish language podcast, and have created an avatar that would make it friendly to as we were recording the different episodes, and created a brand. As you see, Juntos created the logo and created Juntos Radio, and then Salud Sin Filtros, which means health without filters. And so we developed the format in which each episode. And the thing that we also knew was we wanted to have short episodes. We didn't want it to have something long because we didn't want to lose people's attention. And so usually the videos tend to be between 10 to 15 minutes. And if it's a topic that we have more content for it, we tend to break it down in two. So we can have, part one, maybe do the intro, and then have part two, which goes into more detail because we wanted to have snippets which cover topics. And so what we do is the format is we have somebody asking questions in an interview format to various healthcare providers. And in addition to that, you have the video, you have them interacting with someone that is interviewing them to make it more casual and more not too formal. And then once the topic is covered, we add at the end, like I mentioned, credible consumer health resources that where they can find additional information on that topic. And we started the project in 2019. So when we did the project itself, we looked at some of the important health topics that had to do with the Latino population. And so we decided, diabetes, chronic disease. So we were definitely seeing some of the searches that were being done by that population and decided to go about and looking, exercise, alternative medicine, depression, anxiety. So we had a lot of list of topics that we decided that we wanted to cover on the different episodes. Once we went to the early this year and COVID-19 happened, we realized that we had to also include topics that were relevant then when it came to what was COVID-19, wearing masks, talking about vaccines, talking about clinical trials. And you see that those are one of the topics that even we already had a set of topics that we wanted to cover, but when this happened, we decided to also make it more relevant and right away got to do episodes that were relevant on those topics. Now, since a lot of the times you might work in libraries where you get questions about consumer health resources, I'm just want to take the time here to see what kind of consumer health resources do you recommend your users when you have questions, or you have to answer that to anyone that you're helping. And you can put that in the chat if there's some commonly ones that you use. And I'm just looking at the chat, giving you a minute or so to see if you want to share some of the resources you use. Medline Plus, yeah, definitely is the one that I've been saying a lot. And I definitely, when it came to finding supporting information, I definitely use that a lot. Any other ones? And I know that that one is very general. And so, let me see. So that's something to keep in mind. So that Medline Plus is definitely one. So because there are different questions that can cover different things, that's one of the ones that I mainly use. But I also, some of the information, depending on the topic, was coming from the CDC, kidshealth.org, healthychildren.org, NIH, especially when it came to COVID-19, a lot of good information was there, the National Institute on Aging, and the Mayo Clinic. So those are some of the ones that I would review and use to complement that information. So now we want to show you some of the topics we covered. So far, we've done 19 episodes, and we record them and publish them bi-weekly since March 2020. And 10 of those people that we've recorded interviewing them with the health topics have been nationally known health professionals, and they share their expertise and they do the interview in Spanish. And we've covered 11 health topics, and some of those topics are on the right. You can see we ended up doing topics on COVID-19, child obesity, Alzheimer's. That's why, as you notice, one of the resources I used was the NIH on aging, pre-diabetes, clinical trials, vaccines, and I actually was able to also do an episode on health literacy and talking about the importance of health literacy because I speak Spanish. So it was great to just be part of the organizing of the project itself, but also being able to be one of the guest speakers talking about health literacy to our Latino population. And so as you can see, we're very fortunate that we were able to get people from the university that wanted to do the recordings. I know that one of the people that we had who talked about clinical trials, he is heading a clinical trial at our university. And it was great that he was talking about the project that he's involved when it comes to the vaccines and getting people to recruiting people, especially from the Latinx community, to make sure we get a very diverse, inclusive population that is participating. So it was great to have him do the recording and talking about his clinical trial and talking about vaccines. So it's been really great to see the diversity of researchers and healthcare professionals that have participated in the recordings. So when we started doing the recordings in the fall, early this year, we were able to meet in person. So as you can see in the pictures in this slide, we actually would meet in a conference room, and there's Mariana and Liliana, one of the other co-authors of the presentation, and here's one of our researchers talking, and we were recording them in person, just having a casual conversation like if we were doing a radio talk. But that's how some of the earlier topics were covered. As COVID-19 hit, we had to go and do them through YouTube, and so we now, as you can see in the bottom, had to have people look at the screens and do the recordings that way. And so what we do is when we do the recordings, we do the editing, we add the content to supplement with the health information and the websites that are relevant to that topic specifically. And then, like we mentioned earlier, bi-weekly, we put the episodes and we share them through Facebook, to YouTube, Instagram. We also have WhatsApp, Podbean, Apple Podcast, Spotify, and then we repost them to make sure they're available. And again, they're free, they're accessible to anyone that has those platforms and be able to listen to them. And that's how we promote them. And I know that it started in Kansas, but we're hoping that we can expand it to other places in the country. So here's to give you an idea of how we've been able to reach to some people. The posts, for example, you mentioned how many we posted on YouTube. This is how many views we've had for the different topics. And as you can see, depending on the relevancy, for example, the one that you see the highest one here, where it says it's episode 9, which is about the COVID-19 vaccine. A lot of people were interested in watching that and learning more about what research is being done on that. Or at the beginning, we did COVID-19, and then you see something about, we wanted to mix it up with some of those topics that we already had in mind to include. So as you can see, the second one has to do with obesity in children. The third one has to do with Alzheimer's. So as you can see, the highest one has been the one about the vaccine and COVID-19. Then you have the episode 1 about COVID-19 as a whole and what it is. And then this one, which is 1, 2, 3, the fourth one you see there, it's about exercising when you are staying at home. So as you can see, people were really interested in seeing that. And then you have this one, which is Alzheimer's part 1. And then this one is about, like I mentioned earlier, about obesity. So those you can see how many views they've had. And then here in impressions, how many people had liked them. And again, there's a variety of them. And you can see we've reached to a lot of people that go and see those videos because they're interested in it and they're in their language and they have resources credible resources attached to it, and healthcare professionals that are speaking to them in their language in a casual way, not too professional, but in a way that it makes it more relatable. Then here's how we reached in Facebook, since we mentioned that Facebook is another platform that we use and people reach out to the website. And so again, it's interesting to see which platforms get more attention, because if you notice here, the one that has the highest views, it's episode 6 right here, which is the one about hypertension, and it's part 1. And then you see the second one is, do I have pre-diabetes? And then, of course, here's this one when it comes to COVID-19 and the vaccine. So it's interesting to see that in the different platforms, the type of attention and which videos tend to be seen more. And then we use the platform Podbean for the podcasts. And again, as you can see, there's been 303 downloads when we posted 14 episodes in that platform. And again, the episode 1 that we posted at COVID-19 has been the one that has had more of the downloads. And then you have the thing, the one about obesity in children, and then pre-diabetes. So that tended to be similar to what we saw in YouTube for sure. So I wanted to quickly just show you, just share with you some videos to see how it works. So I think I'm gonna stop sharing because I didn't share the sound earlier. So I'm gonna share my sound in the computer. I'm gonna share this again. And that way, just so you can see what they look like. So here's what we have. For example, here's the podcast. And if you see, for example, one of the ones that we posted was alcoholism. And see, we have it there. So now we have more downloads and 16 episodes. And as you can see, here's the topic. And you can see in the bottom where you see recursos del episodio is a lot of different links to the resources. Like I mentioned earlier, you see Medline Plus, a lot, and other publications that have information on that topic in Spanish. And so you can see a lot of them, and then our contact information. And when they're listening, they can hear them and they can also see those resources. So that's why we have them in Podbean there. And again, it's free. You can download it and be able to listen to it if you have the app. And then here's the video of how we were recording them. So you can see the different topics available there when it came to COVID. So for example, this one, she's one of the researchers that is doing research on vaccines. So we have the logo.
Bienvenidos a Juntos Radio, el programa de salud sin filtros. Mi nombre es Mariana Ramírez y soy directora del Centro Juntos en el Centro Médico de la Universidad de Kansas. Este es un trabajo en coordinación con la Biblioteca Nacional de Medicina y todos sus derechos están reservados. Hoy tenemos la continuación del episodio de las vacunas y está con nosotros Leti Núñez Argote. Muchas gracias, Leti, por estar con nosotros y contestarnos.
Estudiamos el desplazamiento de las comunidades.
And as you can see, when they're watching the video, it's visual and it has the website and it tells them the information that they're doing, and so they can see that and have someone that's
por otras fuentes como lo que se encuentra en la comida o en el agua, enfermedades más peligrosas que podrían contraer antes de los 2 años. Las vacunas se aplican en serie.
So definitely, as you can see, we have that video, and then we also have it in Podbean and in Facebook and other platforms to be able to see them. So I just wanted to show you that so you can see how they're available. So in terms of the project itself, as you can see, we had some health topics that we wanted to cover, and then COVID-19 hit. And so we definitely prioritized on those topics because we knew that we wanted to get that information out there. So we're hoping that right now, as you can see, we have several views. So now we're trying to spread it out and make sure that people know about it in other places. I know that there's in reaching out to the Latinos. And so we want to have awareness of NLM information resources. So they're presented at each episode, as you can see, and have more acceptable and more content and that they need. So I mentioned we had those topics earlier, and then we're talking about COVID-19. And so there's a lot of other topics that we hope to cover moving forward with the project. And this is just getting started. We only have 14 out there, and we already have ideas of things that we're gonna incorporate. I know that I was in a presentation last week, and one of the researchers does work with epilepsy, and she learned about the project, and she said, oh, I would like to have an episode about epilepsy. We have a researcher that speaks Spanish. Can we have her be part of it? And so she's going to be part of it, and I can find more information on that. So, and again, even the videos, one of the things that you can do is, we're hoping that I see Emily's comment that we could definitely promote it in hospital waiting rooms or anything like that. I'll keep that in mind. That's a good way of reaching out to the patients or the families. Are they watching or waiting in the leave. That's a really good idea. So I definitely want to keep that in mind. So we wanted to have it accessible to people to cover the topic, but also to know that there's resources that they can be able to incorporate that is adding to that. And keep that sharing, because I know that I had someone that is working on rural communities in North Carolina, and she heard about this, and I sent her the links, and she said, "This is great. I'm definitely want to promote this to the community that I'm doing outreach with in North Carolina." She works with East Carolina University, and I have someone that in California that does the same thing. So again, we're trying to. It started here in Kansas, and I know that we still need to reach out to a lot of the community in Kansas, but definitely if you work in a library, in a public library, that you have a lot of speaking, patrons, I would definitely please take a look at this and be able to use them with them. And again, it's been a team effort. It's been really great working with Juntos and the researchers, and it's been a lot of great support from the university too, knowing how this is reaching out and the idea and thinking about using technology and reaching out to our users, because we want to go to where they're using the resources and go to them. And so I'm really happy that this has been working out. And I know that we're still have a lot of work to do when it comes to promoting it and getting the word out there, but I think it's a good starting point to reach into the community and getting that information in their language right away and in their own phones. So this is more, for librarians. So what can we do to reach our users? In this case, we mentioned in this project, we use the podcasts, we use YouTube and Facebook, which a lot of libraries are using. And so things to keep in mind, especially if you're doing outreach when it comes to health literacy or healthy eating, definitely promote the podcast to your users. It's free, or have it accessible through your library's websites. If you have a live guide when it comes to consumer health information, especially if it's in Spanish, this is credible information, credible experts on the field that are doing the research, and so they're sharing their experiences and what they're doing. Creating community-wide partnerships in whatever you're located, that's a great way to reach out to them and educate them. And somebody's asking about flyers that we can print. Yes, we have. Would you like sending your email there? I will be happy to send you that, Elish, for sure. And in that way I can contact you, or you have my email, definitely email me directly too. So if you're doing adult health education programming, this is a good way, something that you can promote to them and use it. And something that I know that a lot of the times is, trying to get them educated before an emergency strikes. So right now, when it comes to COVID-19, we had to do that information, but we right away created something early on so that people were being educated. So or when it comes to information of diabetes, like I mentioned, Alzheimer's, that community needs more information about it, because sometimes they know about it, but sometimes they think, oh, that doesn't affect my community, when it does. But because there's not that much information in Spanish, they don't think to follow that. Again, we use a lot of social media and for promoting sometimes our events and the programming. Definitely try to think about how can you reach them this way. I know that eventually when a lot of the libraries were closed, a lot of people were using Facebook to do live storytelling, and so there's doing teaching and classes. I think it's a good use of that. And please apply to NLM grants and funding. They have money available for public libraries. Don't think that funding is just for medical libraries. They want to partner with public libraries, hospital libraries, any type of libraries that could reach out to the community and have interesting projects or outside the box projects that where they can promote health information or information literacy. So things to keep in mind, as you notice, YouTube and Facebook, but one of the platforms that we use, because it's free, you don't have to spend money on it. Podbean, it's also free, but there's some limitations. And so the one you can also, I noticed that it depends on the storage space that you want for Podbean. If you want unlimited audio, it is around a 9 monthly fee that you can use to set up some recordings and have it there. And as you see, it's very user friendly. One of the things that we had to have access to was editing software, especially when we had the videos, to be able to edit some of those episodes that were long and have them into 2 episodes. Or again, when you're doing something and you're not really, that's not what you do, you make mistakes, so you have to do a lot of recordings and re-recordings. And so definitely spending on some of that money. And I know that sometimes there's free editing software out there that you can look for. In some of the images we use for the presentation, we use public domain images, and that way we didn't have to spend money on that. And we did use some of the money that we got from the grant for the mics and the headphones and some of the editing software, because we were fortunate to get the funding for that. So I have some time available. So one of the things that I wanted to take this time to before I end my presentation is, many of you probably have questions about COVID-19, and there's a lot of resources out there in English, but I was just wanting to see if anybody here that it's in the presentation has had to deal with providing information about COVID-19 to their users, particularly in Spanish or just in English. And I'm just going to open the chat to see if anybody has any experience with that. If you had to answer any questions. Okay. And I don't see anything in chat, but I'm going to keep it to see it. But one of the things to keep in mind is I wanted to showcase some resources available that you can also add to your library list of resources. So here are some of them that we as medical librarians put together. This is Nora. She's at the NLM Pacific Southwest region. I mentioned that there's different ones around the country. She's located at the one at UCLA in California. And I'll be happy to share the slides or put the links in the chat. This is a list of Spanish resources that she put together in her region, and it's accessible to everyone in the country. There's also a group of medical librarians, myself included, at the Medical Library Association that wanted to get information out there in Spanish. And so we got together and we have a Google Doc where a lot of us got together. We have some colleagues in Las Vegas, California, North Carolina, myself here in Kansas, that we wanted to put something together for Spanish-speaking populations. And so this is something that you can go out there and be able to put that and link it to it. So I'll be happy to put that in the chat after I do this. And again, this is a group of medical librarians, so it's credible information that you can use, and we know that it's authoritative. Something else to Health Reach with it, which is has a lot of information in various languages. So I definitely recommend looking into that. There could be some information, not just in Spanish, in that website. And you can see, you can search by languages, and there's information there, not just about COVID-19, but other health topics that you potentially could be able to use. So I definitely recommend that to become familiar with our website. And then here's the Rural Women's Health Project, which is really interesting too. They do a lot of outreach, and if you think about it, we always are focusing on Spanish-speaking population, but a lot of the times in some countries, for example, in Central America, in Guatemala, you have a lot of indigenous communities, and they actually are here in the United States, and Spanish is not their first language. Spanish tends to be their second language, because some of them can speak Quiche, Cachiquel, and so how do we reach out to those populations? And so this is a really good source to reach out and have information on other health topics in some of those languages, as you can see on the left here, indigenous and Mayan language covered material. So that's something useful to have access to, but also know about this resource if there's some of those populations close to where you provide services in your library. Question ideas. I always say that right now, when it comes to health information, health literacy, is really important to advocate for that community. A lot of them don't have a voice, and we as advocates for health information and access, we can be their voices and being proactive and seeing how we can think outside the box and reach out to them, not just the Spanish populations, but other populations out there that that English is their second language. And so there's a lot of opportunities to reach out to them in different ways, using technology, using social media. And so keeping that in mind, also being inclusive and being culturally sensitive if we are the ones creating that information and we're the ones reaching out to them to provide this information to them. And like I mentioned, thinking outside the box and being resourceful and creating partnerships and reaching out to other people. We don't have to reinvent the wheel. There's a lot of things that other people have done already. Like in this case, we've done this podcast. There's the health literacy aspect of it. It's already in Spanish. Use it and promote it for sure. So with that, that concludes my presentation. I wanted to add those extra resources because I thought it would be important for you to have access to that. I'm going to add some of those links that I have in my presentation into the chat. But please, if you have any questions, reach out to me. I'm happy to talk to you more about any grants, or if you're interested in applying for something with the National Library of Medicine. If you want to collaborate when it comes to health literacy, please let me know. We want to do more outreach in Kansas. And I know that one of my colleagues, Margie, did a presentation earlier this morning. And she could be also a really great resource to do more outreach in the community when it comes to health literacy and health information resources. So now I'll just open up to questions if there's any other questions. And I'm going to stop sharing my screen and I'm going to put some of those links in the chat. Thank you so much.
And just so everybody knows, the slides are on the website here under presenter information. So, yep.
Great.
So those are available.
Great. So I'm just going to put some of those links, but like, you know, they said since they're there, definitely take advantage of that. And I'm definitely going to follow up with the idea of the flyers, because I know we have something and we definitely would love to promote that to the libraries and, you know, make sure you have access to those recordings and be able to promote it in your communities for sure. So any questions, comments? I'll be happy to answer your question or any ideas that you might have. Mm-hmm. And bear with me, I'm putting some of those links in chat, although I know that they're available there, but if you want to go directly to it. Thank you again for including me in this. I really hope that you got some ideas or some useful information of things that you can incorporate in your library.
Yeah, absolutely. This is a great session. Thank you.
Okay, I think I put, those are some of the ones to keep in mind. The list for Health Reach, the guide from my colleague in California, and then the other one, let me know if you have any issues. That's the Google Doc that we all created and incorporated information into it, and for sure.